Good day, I am Richie Tricia, Hidalgo, student nurse from Hidalgo Doctors College, and today I will be performing a return demonstration of parenteral administration through the intradermal, subcutaneous, and intramuscular, including the preparation of medication through vial and an ampule. Now, first is to check the doctor's order to verify the order. And after that one is to check the medication administration record to verify the medication, dose, and route. And next is to check the label on the medication carefully against the medication administration record to ensure that the right medication will be prepared. And next is to check the label of medication 3 times. The first one is when taking the medication from the medication cart, which we already done earlier. And the second one and the third one will be done later, before and after withdrawing the medication. This is to ensure that we are preparing the right medication. And then next is to organize the equipment to save time and effort. So we have here for intradermal, we have the vial, the medicine from a vial and the sterile water, filter needle, tuberculin syringe, clean gloves, black ball pen, and for the subcutaneous we have the insulin syringe, and for the intramuscular we have the 3 ml syringe, the gauze pad, alcohol, and the cotton. Next is in preparing the medication for vial. First is to wash your hands and then wear gloves to deter the spread of microorganisms. Next, prepare the medication vial for drug withdrawal by rotating the vial between the palms to mix the medication inside. Ensure that you're not shaking the vial as it will create bubbles, which will lead to an inaccurate dose when you will be withdrawing the medication. And then next is to remove the protective cup or rub the rubber cup of a previously opened vial with an antiseptic wipe in a circular motion to maintain septic procedure. But since this vial is new, I will just be removing the protective cup. And then withdraw the medication by attaching the filter needle to the tuberculin syringe to draw out the premixed liquid medications from the multi-dose vials to filter the medication. And then ensure to firmly attach the needle to the syringe so that it will not deattach later. And then set it aside first because we will be doing the second checking of the label of medication. And then now is to remove the cup and then draw up the amount of air equal to the volume of medication into the syringe, which will be injected later to the vial. And then carefully insert the needle into the upright vial through the center of the rubber cup, while maintaining the needle's sterility to prevent spreading the contamination. Now position the bevel up, insert the needle, and inject the air to the vial. Now withdraw the prescribed amount of medication by either holding the vial down like this and then move the needle tip below the fluid level and withdraw the medication. Or you can also invert the vial and then move the needle tip below the fluid level and gradually withdraw the medication to ensure that you are withdrawing the medication and not the air. Now replace the filter needle with regular needle. Discard this filter needle to the sharps container. This is, by the way, the regular needle. Set this aside and now do the third checking of the label against the medication administration record. Now next is preparing the medication from an ampule for intramuscular route. Now, first is to do the second checking of label of medication. And then next is to prepare the medication by flicking the upper stem of the ampule so that the content on the head part of the ampule will go down to the body of the ampule. And then place the sterile gauze between your thumb and ampule neck. And then break off the top by bending it toward you so the ampule is broken away from you, and dispose it in the sharps container for safety. And discard it to the sharps container. Next is to withdraw the medication by placing the ampule on a flat surface to prevent it from spilling. Next is to attach the filter needle to filter the medication. And then remove the cap and insert the needle into the center of the ampule without touching it to the rim of the ampule so that the broken glasses on the rim of the ampule will not stick to the needle of the filter needle. And then hold the single dose ampule slightly tilted to get more than the ordered amount of medication. And then next is to dispose the filter needle to sharps container for safety and replace it with a regular needle to prevent injecting the glasses being filtered from medication. So here is the regular needle. Attach it back. And then do the third checking of label of the medication. And then discard it for safety. Now in administering medication through intradermal, first is to explain the patient will feel a slight prick and the medication will produce small wheal like a blister to the patient to gain trust and cooperation. Good day, I am Richie Tricia, Hidalgo, your student nurse for today. And you are?
I'm Mildred Hidalgo.
May I check your wristband, please? Can you state your birth date?
July 27, 1974.
Okay, thank you. And how would you like me to call you?
Mildred.
Okay, Mildred. So today I will be doing an allergy skin test to know if you're allergic to this medication that will be given to you later on. It will cause slight prick as I will be inserting a needle to your skin to form a wheal like a blister. Will that be alright?
Okay.
Okay. And next is to provide privacy to gain trust. And as you can see, I have closed the door for your privacy.
Okay.
And then select a site that is not tender, inflamed, swollen, or has lesions to prevent further pain. Now, can you place your arm over here? Okay. So there are no any lesions or tenderness. And then next is to apply clean gloves for personal protection. Next is to cleanse the site in a firm circular motion from inner to outer to prevent forcing microbes into the skin. Then let it dry. And discard this cotton ball. Next is to prepare the syringe for injection for convenience by removing the needle cup while waiting for the antiseptic to dry to save time. And then expel the air bubbles from the syringe to ensure the accuracy of the dispense. And then grasp the syringe between thumb and forefinger of dominant hand. I am right-handed. And then point in 10-degree angle with bevel up for smooth piercing and induction of medication. So the bevel is already up. Next, pull the skin with non-dominant hand until it is taut for easy entrance of the needle. Now, insert the needle until dermis where the solution will be injected. And then stabilize the syringe and inject the medication to form a wheel. So it is not necessary to inject all of the medication in the syringe. It is enough if the bleb is already formed. And then withdraw the needle at the same angle quickly to minimize skin damage. And then discard the needle to sharps container to avoid accidental pricking and apply bandage if indicated. Ensure not to massage the area to minimize patient's discomfort. Discard the gloves and perform hand hygiene to prevent the spread of microorganisms. Discard the gloves. And then next is to encircle the wheel with black or blue pen to observe for any skin allergy. Okay, so Mildred, I will be encircling this one, okay? And then next is to document relevant information, including medication given, time, dose, route to indicate that you are done doing the test. Okay, so skin allergy test was done to patient Mildred at 9 a.m. with 0.3 ml of streptomycin from a premixed vial through intradermal. And after that one is to evaluate after 30 minutes to know if the patient is allergic to given medication by measuring the areas of redness and induration. So assuming that it is already 30 minutes after I have injected. So Mildred, I am back and I will be checking again the injection site. May I see? Okay, so there are no redness. Does it feel itchy?
No.
Okay, so it means that she is not allergic to the medication. And lastly is to document the findings if patient had positive or negative skin test result for clinical communication. So the result says that patient Mildred is not allergic to streptomycin. Now for subcutaneous route, provide privacy to gain trust. Okay, so as you can see, I've closed the door for privacy.
Okay.
And then next is to introduce yourself and verify the patient's identity to ensure that medication is administered to the right patient. Good day, I am Richie Tricia, Hidalgo, your student nurse for the day, and you are?
I'm Marites.
May I check your wristband, please? Kindly state your birth date.
July 27, 1974.
Okay, thank you. And how would you like me to call you?
Marites.
Okay, Maritas, may I know if you prefer communicating in English or do you prefer in Bisaya or Tagalog?
English, please.
Okay, so I will be injecting insulin at the back of your arm. Will that be alright?
Okay.
Okay. So, after that one, after introducing yourself and verifying the patient's identity, next is to position the patient's arm to be relaxed, and if patient is uncooperative, like children, ask for assistance to hold the client for easy administration of the medication. Okay, now kindly face over here and just relax your arm. And then next is to explain the medication's indication and side effects so that patient will be aware. Okay, so Maritas, this is insulin that I will be injecting to you now to control your blood sugar within normal range. This has side effects such as redness, swelling, and itching at the injection site, as well as weight gain, sweating, and dizziness. Next is to select a site that is not tender, inflamed, swollen, or has lesions to prevent further skin damage. So I've chosen this site, and it is not swollen, and there is no lesions. Next is to wear your clean gloves for personal protection. And after wearing your clean gloves is to clean the site with antiseptic swab in circular motion from inner to outer for about 2 inches to prevent forcing microbes into the skin, then let it dry. And discard. And then next is to hold a swab between your third and fourth fingers of non-dominant hand for convenience in covering this site after injecting. And then prepare the syringe by removing the needle cup by pulling it straight off to avoid contamination of the needle. And put it straight to sharps container. And then inject it by holding it between thumb and fingers of dominant hand on 45-degree angle to reach the subcutaneous layer with control. And then pinch the site with non-dominant hand and inject it with dominant hand in firm, steady push to prevent further skin damage. Okay, Martas, I will now inject, okay? And then now move the non-dominant hand in at the end of the plunger to inject the medication by depressing it in slow and even pressure to prevent further pain to patient. And then after that is to pull the needle in the same direction when we inserted it for minimal skin damage. And then depress the skin with non-dominant hand to reduce pain, but if bleeding occur, apply pressure until it stops to help in blood clotting. Next is to dispose the material appropriately to sharp objects will be thrown to sharps container for safety, and then assist the patient in comfortable position to promote ease. Okay, you can now sit in a comfortable position. And then perform hand hygiene to prevent the spread of microorganisms. Throw it to the trash can. And then, when the time that medication is expected to act, assess the effectiveness and based to the medication I gave. Checking the blood sugar level will help to know the effectiveness to determine if the medication helped the patient's condition. So assuming that medication already acted. Okay, so I am back and I will now assess the effectiveness of your medication if it acted already. And by doing that, I will be checking your blood sugar. Can you please place your hand over here? Now I'll be pricking this one. Okay. So as I check, your blood sugar is within normal range. And then document all relevant information for clinical communication. Now for administration through intramuscular, first is to check the MAR to verify the medicine, dose, and the route. Check the label against MAR and do the 3 checks, which is when taking the medicine from medicine cart and before and after withdrawing the medicine to ensure that right medication will be administered, and organize equipment to save time and effort, which are all done earlier when preparing the medication. Next, perform hand hygiene to deter the spread of microorganisms. And then prepare the medication, which was already done earlier. Next, provide privacy to gain trust. Okay, so as you can see, the door is already closed for your privacy. And then prepare the patient by introducing yourself and verify the patient's identity to ensure that medication is administered to the right patient. Good day, I am Richie Tricia, Hidalgo, your student nurse for the day. And you are?
I'm Mirasol.
May I check your wristband, please? Kindly state your birth date.
July 27, 1974.
Okay, and how would you like me to call you?
Mirasol.
Okay, Marisol. So, may I know if you prefer communicating in English or you want to use in Bisaya or Tagalog?
English, please.
Okay, so today I will be injecting this medication on your arm. Would that be alright?
Okay.
After that one is to position the patient's arm to to be relaxed, and if patient is uncooperative like children, ask for assistance to hold the patient for easy administration of medication. Okay, Marcel, can you please face this side and just relax your arms. Next is to explain the medication's indication and side effects so the patient will be aware. Okay, Marcel, so this medication that I will be injecting now is streptomycin to treat your infection. This has side effects such as dizziness, vomiting, black stools, stomach pain, and loss of appetite.
Okay.
And then after that one is to select a site to choose the best site to deliver the medication through ordered route. And me, I chose the deltoid muscle as it is more accessible. And then ensure that it is not tender, inflamed, swollen, has lesions, or used frequently. If it is, find alternate sites to prevent further skin damage. Okay, so as I see, it is not swollen, there's no lesions. May I ask if this site is being injected frequently? No. Okay. Next is to locate the exact site for injection to prevent hitting the sciatic nerve. Now, in locating the injection site of the deltoid muscle, all you have to do is to place your 2 fingers from the acromion process, and with your other 2 fingers, form a triangle, and the center of the triangle is the injection site. And then wear clean gloves for personal protection. Now, after wearing gloves, is to clean the site with antiseptic swab from inner to outer to prevent forcing microbes into the skin. You have to do it in circular motion. And discard. And then hold a swab between 3rd and 4th fingers of your non-dominant hand for convenience in covering the site after injection. And then prepare the syringe by removing the needle cup without contaminating the needle to maintain sterility. Put it straight to sharps container, and with prefilled unit dose medication, avoid dripping on the needle, but if it happened, just wipe it with sterile gauze to dry it. Next is to inject it using Z-Truck technique with the ulnar side of your non-dominant hand and pull approximately 1 inch to the side to seal the medication in the muscle after administration. And then hold the syringe with thumb and forefinger for control like this, and pierce the skin quickly at 90-degree angle to reach the muscle. So bevel up. Okay, I will not inject, okay? And then next is with non-dominant hand, hold the barrel steadily and aspirate for 5 to 10 seconds with dominant hand to really know if needle reach the muscle. Now, if there is blood, withdraw the syringe and discard and start again. But if there is no blood, proceed injecting the medication slowly with 10 seconds per ml for lesser pain. Now, if using ventral gluteal site, wait for 10 seconds after injection so the medication can evenly disperse in the muscle tissue. Next, withdraw the needle smoothly at the same angle of insertion to prevent further skin damage. And then apply gentle pressure with dry cotton to reduce pain, and do not massage to prevent the drug to back up. If it is bleeding, apply pressure with sterile gauze until it stops to help with clotting. Next, discard this uncupped needle to sharps container for safety. Okay, we're now done. You can now place yourself in a comfortable position. And then discard gloves and perform hand hygiene to deter the spread of microorganisms. Okay, And next is to document all relevant information such as time of documentation, medication, dose, route, and the client's reaction to indicate that medication is already administered. And then when medication is expected to act, assess the effectiveness and based on the medication I gave, check the count of white blood cells on the result of blood tests to help to determine if the medication has effect already. Okay, so the white blood cell of the patient is already within the normal range.